Can you present your clinical findings?
I believe that this patient has inflammatory bowel disease. The positive clinical findings on examination which have led me to this diagnosis are that, first of all, that this is a young patient who has no evidence of any disease peripherally, but on examination of the abdomen she has evidence of previous abdominal surgery. Also, she has a stoma in the region of the right iliac fossa. The contents of the stoma bag are semi-liquid, which makes me believe that this is likely to be an ileostomy. She also has a scar consistent with a previous stoma site in the left iliac fossa, which is possibly due to a mucous fistula at the time of previous abdominal surgery.
How would you investigate a patient with inflammatory bowel disease?
There are a number of different approaches we would use to investigate a patient with inflammatory bowel disease. The first would be that we would do blood tests to look for any evidence of anemias. We would do full blood counts, and we would also check patients' vitamin levels, so folate, B12, to look for any evidence of malabsorption. We would also do urea and electrolyte levels, CRP, to check for any evidence of active inflammation, and also liver function tests to make sure there's no evidence of any liver abnormalities as an extraintestinal manifestation of inflammatory bowel disease. We would do stool cultures to look for any evidence of infections within the bowel, and then we would do an abdominal x-ray to look for any large or small bowel dilatation or any toxic megacolon as a result of inflammatory bowel disease. Finally, we would refer patients for endoscopies, in particular a colonoscopy, to perform biopsies of the large bowel to try and make a distinction between whether this is Crohn's disease or ulcerative colitis. Though what I should say is that in this case, this patient has evidence of an ileostomy, which may suggest that she has had a previous colectomy, particularly given that there was also evidence of a previous stoma site, which could have been a mucous fistula. Therefore, in her case, a colonoscopy would likely not be possible if she doesn't have a colon, and we may need to consider endoscopy via her stoma to look for any other areas of inflammation if she had ongoing symptoms.
Can you describe some differences between Crohn's disease and ulcerative colitis?
So there are a number of differences between Crohn's disease and ulcerative colitis. Ulcerative colitis affects predominantly the large bowel and affects the rectum and the sigmoid colon more than any other parts of the large bowel. Whereas Crohn's disease can affect any part of the GI tract. Ulcerative colitis does not normally cause any problems with the anus, though Crohn's disease can cause a number of problems with anal fissures and anal fistulas. Ulcerative colitis is a condition which only affects the mucosa of the large bowel, whereas Crohn's disease is a transmural condition which can cause fistulas, and ulcerative colitis tends to cause lead piping fibrosis of the large bowel, which is not normally apparent in Crohn's disease.
Thank you.